Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services, including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning.
Tom, we were talking a little bit last week about terms within nursing home contracts that are creating impressions that people are not permitted to apply for medical assistance. Is that true?
No, not at all. And so if you do things properly and follow the law, you're able to apply and follow up on your rights.
And so we have people seeing that it says they can't make transfers. Well, the reality is the Medicaid rules do permit transfers done appropriately, which most lay people are not capable of doing. Yeah. But done appropriately, you can fully exercise your rights no matter what that contract says.
Yeah, that's a good point, because as long as the nursing home's paid, it doesn't matter where they're receiving the money from. So whether it's your pocket or the federal government's pocket, as long as they're paid, they have no claim.
And we have nursing homes in this area implying that people are not permitted to apply for medical assistance. Is that true?
Not at all. You always have the right, as long as you're eligible and follow the rules. The federal and state rules trump any kind of state or local nursing homes thoughts.
And the reality is, because Medicaid is paying for excess of 50% of the nursing home beds in the United States today, in our viewing area many times significantly greater than 50%, right. They're essentially the 800-pound gorilla in the room. They do not run the show. The feds and the state run the show.
Exactly, and so the nursing homes need those dollars in order to meet payroll, and so they're not about to do anything that would cause them to lose that funding stream.
One of the problems that we have, though, is we have a number of nursing homes suggesting to families, you don't need an elder law attorney, we're going to do this for free.
Oh, absolutely, except it might cost you $100,000 in nursing home costs.
Because the reality is that if the nursing home did it for free, just by way of example, and it was a single person case, how much money do they have at the end of the day?
Well, Pennsylvania, it may be as low as $2,000, so you just blew it all.
And so the reality, even if we as an elder law attorneys did the case and we accomplished absolutely nothing, which would clearly not be the basis for us moving forward on it, you would still have the $2,500, $2,000, depending on the program that you're involved with. Yeah. And so it is an illusory savings.
Exactly. And so we almost always have a positive outcome which benefits that family, and that's the goal.
And unfortunately, these nursing homes make applications at times that are untimely, two particular times, which are?
Well, if you're over-resourced or in any other situation where you're not eligible on its face.
And so they'll make an application at a time where you're clearly not eligible, creating an impression that you're never going to be able to qualify for benefits. And really what it was an inappropriate application.
It's very frustrating, because families will get a denial notice with no explanation, and so they figure, oh, better spend all the money. And the reality is it just wasn't done properly.
You know, and I oftentimes characterize this, if you got a tax assessment on your house for $2 million, would you just roll over and pay it?
Well, exactly. You'd explore your options, figure out what the rules are,
hire
and do it right.
And,
lawyer up.
And the fact that people just roll over on this stuff without getting a second opinion, or an opinion that is focused on your interest, is just beyond comprehension for us.
Oh, exactly. I mean, there's some nice folks that work at these nursing homes, but they're not on your side. They work for the nursing home. They're trying to get the nursing home paid. And that's the difference between them and us. I mean, we work for the family.
And then oftentimes we have them make applications when a person is out of money, and then you find out about those transfers that have been made to your ne'er-do-well brother or the car that was bought for a granddaughter. You said no gifts, but in fact there were gifts. And now you've made this case a lot harder than it would have been had you explored those options before you got that far down the path.
Exactly. Once you run out of money and potentially don't have a way of repaying loans or gifts and things, then your options shrink. So it's best to get on top of it as soon as the admission occurs.
And even if you have totally messed it up, people are shocked that most of the time we can still reduce the negative impact substantially, even if you have totally made a mistake here.
Yeah, that's a good point, because in many cases people do inadvertent stuff or just normal things, and they have consequences, so we can minimize the damage.
And so, you're staring in the crosshairs of a $10,000 a month problem, and the fact that people somehow think it's cost effective to not go see a high quality elder law attorney to find out what your options are, because you can't afford to pay for a consultation with an elder law attorney, while at the same time paying $10,000 a month in a nursing home. That calculus makes no sense.
Exactly, and so you should get a second opinion no matter what goes on in your life. If there's an issue, get an answer that makes sense.
Tom, as always, thanks for taking time to appear on our program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance worries to us. Write Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Douglas A. Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to a special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is John Kenney, Program Manager, Adult Services, Washington County Department of Social Services. Welcome to the show, John.
Thank you. It's a pleasure to be here today.
So I passed the many competency test on getting that title out.
Oh, you got it perfectly.
Yeah, John, one of the great challenges that we have in dealing with the retirement community, obviously the Department of Social Services is worried about child support and welfare programs, food stamps and so forth, but it also has a concern for safety.
Yes, we do. We're always interested in the safety and well-being of disabled people, especially older adults, and of course children.
And so as we look at that process, we look at people, there's a lot of media focus on exploitation and so forth, obviously a concern, but there's an equal concern for third parties perhaps trying to sell substandard products or a product that doesn't even exist.
Yes, it's a growing problem. It seems that older adults are being targeted by scammers of various sorts. Oftentimes they're calling on the phone and pretending to be from a legitimate agency, etc., and then they're asking for personal information that they can use to tap into the person's accounts for benefits. They also are selling products that maybe don't exist or are not as portrayed.
Or they may be knocking on your door offering home improvement services and so forth. And as we basically say, no reputable contractor does business that way.
That's true. Anytime somebody's doing that, you should probably advise them to go away. You're not interested.
And I know that you work with local law enforcement to try to help people from being exploited by those scams, but sometimes it's after the fact. So really education is a part of the process as well.
That's very true. Usually by the time we get the call, a lot of harm has already been done and the person has probably been scammed out of resources. They may have even been scammed out of their home.
Well, one of the other things that you work with too is the fact that we find an awful lot of the retirement community automatically presupposes, because they're middle class, that there's no benefits available to them. And in fact, there are a number of benefits still available to them, even for people who would not consider themselves in need of the classic food stamps.
Yes, that's true. The Adult Services program is designed to help people who, while aren't wealthy, are of moderate means. So that most people are not really determined to be overscale in terms of their income that we find referred to us. So we're able to provide case management based on their need. A lot of times we're able to help them with some services in the home, personal care, assistance with bathing, dressing, with some chore services. We generally purchase those from other companies.
So it's not going to be around the clock 7x24 care, but it might be a respite, or it might be, coming in for a few hours per week and providing some assistance.
Yes, that's the type of help we generally provide, and we do have some funds available to be able to purchase some respite, and the family can usually line up who they would like to do that, and we can pay for up to about 120 hours per year of that type of care. The only round-the-clock care we offer is under Project Home Adult Foster Care Program, where people can be placed into one of our 21 care homes around the county, and we help get the funds to be able to pay for that care.
And while we're talking about Washington County, almost every Department of Social Services in our viewing area is going to have similar styles of programs.
Yes, they are. All the Maryland Departments of Social Services offer those basic services to the public, so that one could call their local Department of Social Services and request these kinds of help, and they should have very similar experiences that they would by calling us at the Washington County Department of Social Services.
I know you work with the Commission on Aging as something called a benefits checkup, that people can actually go online and try to figure out if they're entitled to something.
Yes, and the Commission on Aging, through their Maryland Assistance Program, or MAP as they call it, has a benefits checkup, and a person can call in and provide them with information and they will actually do the search for them in terms of benefits checkup, or the person could come in and do it themselves, and it would lead them to what benefits and services they're eligible for.
And lastly, one of the greatest problems that we have is self-neglect.
Yes. The majority of our Adult Protective Services referrals are for self-neglect. It's where the person is not meeting their own basic needs, and they need assistance to be able to do so. We try to work with usually other family members, concerned individuals, to persuade the person to accept some help that they need in order to meet their basic needs at home.
John, as always, thanks for taking time to appear on our program.
Thank you very much.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Guys, I thought you were supposed to be working in the yard.
But Dad, just one more bid on HurleyAuctions.com.
If you haven't visited HurleyAuctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Paul Sweeney, President of Quality First Insurance Agency. Welcome to the show, Paul.
Thanks for having me, Mike.
Always why we have you on. Why are you on a medical segment?
Well, we deal with medical insurance. That's our primary focus, and primarily for people that are retired. And unfortunately, as we get older, we need to use medical services much more.
And one of the great confusion that has occurred is there's 3 or 4 different types of medical service plans out there. There's first of all the Part D plan, which we're in the last days of the annual election. In the old days, that was, you only had supplements. That was the only thing we had to talk about. But now we have Part D, and now we have a substitute program called Medicare Advantage, and you still have the employer plans out there. It used to be pretty easy. But one of the things that we're very concerned about, and we see this misconception all the time, is that a person with a traditional Medicare supplement has to worry about all of these other date-sensitive plans.
You're right. You do have to pay attention to specific time frames, especially for the prescription drug plans. The only time you can really make a change is during the annual election period, which runs from October 15th through December the 7th. So that limits your ability to change prescription drug plans. A lot of people think that that limits their ability to do anything else as well, because there's all kinds of commercials talking about different Medicare plans and different Medicare options. The Medicare Advantage plans are limited as well during that same time frame, but the Medicare Advantage, or excuse me, the Medicare supplement plans are available to change really anytime somebody wants to, as long as you can qualify medically for it.
And it doesn't have to be that you have to be in perfect health. There are some bars, recent hospitalization or so forth may limit it, but the fact of the matter is Medicare is absorbing the lion's share of the cost anyway, so the supplement is only accepting risk for those deductibles.
Right. We review Medicare supplements year long. We talk to people all the time about what they're paying for a supplemental insurance plan, if there's another plan out there that would consider covering them, for example. And it's very common for us to maybe move somebody from one Medicare supplement plan to another in January, February, March, all through the year.
No time limitations.
No time limitations on that.
Yeah, there's time limitations on when you must initially take advantage of those plans within 6 months of initially enrolling in Part B.
Right. When you first become eligible for Medicare, for a lot of people it's age 65, but because Social Security has made some adjustments, many people decide to work beyond 65. So if you become eligible for Medicare Part B at 65 or 66 or 67, that's what triggers something called open enrollment, which is a time frame where you can get any plan you want without any sort of medical underwriting.
And that's triggered oftentimes by a person continuing to be employed after 65, covered by an employer health plan. So if they're covered by the employer health plan, generally they do not need to enroll in Part B.
Correct. There's a law, it's called TEFRA, that mandates that if you decide that you want to be covered by your employer's plan, you don't have to opt into Medicare Part B. Medicare Part A has no cost associated with it, so most people do enroll in Medicare Part A when they turn 65, but it's very common for somebody to defer that if they're continuing to work until they actually retire.
And there's a trap. If you enroll in Part B and you did not need to enroll in Part B and you allow the employer plan to also be a co-coverage in that environment, you've given up a right that you have.
Right. If you decide to enroll in Medicare Part B at age 65 and you're going to stay on an employer plan, you might have made a mistake, because you're going to probably lose your open enrollment period when you actually need it. When you decide to come off of the group plan,
so
6 months or a year later.
You have a big health issue, you have to retire now, and then you find out that you don't have an open enrollment period because you triggered it when you paid the Part B premium when you didn't need to.
Right, and I think a lot of people are confused. They think that, well, if I sign up for Part A, I have to sign up for Part B. You don't have to sign up for Part B if you're still working, and there's no penalty associated with that either. A lot of people think I'm going to be penalized later, but you're not going to be penalized as long as you follow the right steps.
Now, you call them Medicare Advantage programs. I call them Medicare Disadvantage programs. Most people, if they really understood the coverage, would realize that they need to be very circumspect about making a change into a Medicare Disadvantage program.
Yeah, when you enroll in a Medicare Advantage program, you're actually coming out of traditional Medicare. You're setting Medicare aside, and you're allowing your health insurance coverage to be handled by a private insurance company that generally utilizes networks, has very substantial copays associated with it. And
very limited coverage in Florida or Arizona.
If you're traveling or planning on going on vacations quite often when you're retired, you're going to have problems.
Paul, as always, thanks for taking time to appear on the program.
Thanks for having me, Mike.
More from Contemporary Retirement after these messages.
The Community Foundation has helped create signs of community strength for more than 30 years. Scholarships assist with post-secondary education, and grants support programs throughout Frederick County. Making a big impact. Because of generous donors like you. Add your sign of community strength by creating a fund that supports the causes you care about.
Albright, Crumbacher, Mal, and Itel are a full-service firm that provides elder care services, including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. Making Sense focuses on the financial issues affecting the retirement community. With me today is Pete Alexander, a partner in the regional accounting firm of Albright, Crumbacher, Mal, and Itel, with offices in Hagerstown and Martinsburg. Welcome to the show, Pete.
Great to be here, Mike.
Pete, it's December, and we have those retirement accounts, and so the government is very insistent as you reach certain ages that it is time to take money out of those accounts.
Yeah, let's be clear. We have basically two types of retirement accounts. We have what's called the traditional retirement account, and we have a Roth retirement account, R-O-T-H. We are not talking about the Roth retirement account. The money in your traditional retirement account, rather it be a traditional IRA, a traditional rollover from a 401k, tax shelter annuities, those types of things. You have not paid any tax yet on the money in that account, rather it be money you put in or the earnings of that money.
So the government has allowed you to accumulate money tax-free.
And more so, they've allowed you a tax deduction when you put the principal in those accounts. So they don't have any taxes on that money yet.
So ignoring inherited IRAs, which are a little bit different, let's just talk about traditional retirement accounts here. So the government has said the day of reckoning has arrived.
Yes, once you hit 70 and a half, they said we've waited long enough for our pound of flesh. We want you to start taking money out of that account so we may tax it. They're not saying you have to spend it. You can take it out of that account and reinvest it in a non-IRA account in the same identical stock, mutual fund, certificate of deposit, whatever you want to do, but you have to start taking it out so they can start taxing it.
All right, now, you have 3 IRA accounts. Must you take a requirement of distribution out of each one of them?
No, you add them all together. Now you're going to get a notice if you have them at 3 different banks and there's 3 different CDs or 2 banks and a brokerage house. You will most likely get a notice from each brokerage house or each bank telling you what your minimum distribution is. They're only calculating the minimum distribution on the one they're the custodian of. They're not worried about the other one. So if you get one from one brokerage house that says 1,000, the other says 2,000, the other says 3,000, you're not allowed to pick the lower one. Okay? What you're doing is you have to take all the IRAs together, add them up, the December 31st of the prior year balance, add them up, and divide by what the IRS believes you and your spouse's life expectancy is, and that's your total minimum distribution, and you may take that however you want. Take it all out of one IRA, if you have one you don't like the way it's performing, or take it out of all 3.
So you could take 6,000 out of one, you could take 3 and 3. It's not the, and by the way, just because you got one letter from one, it's not the total required minimum distribution, it's the required minimum distribution out of that
Right,
account.
A lot of people get a letter from one and they don't get, or they get the letter from the other ones, but they throw them away assuming it's junk mail, probably another one of those privacy notices you think it is.
Right.
So you get all these letters and you throw them away and you're hanging on to the one letter that says $1,000. So you take your 1,000 out, you pat yourself on the back, and then down the road the IRS audits you and they say you're $5,000 short. The problem with that is you not only have to take that $5,000 out and pay tax to catch up, but the penalties run upwards of 50%. Plus, remember, you still have to pay tax when you take it out. So you could end up losing the whole minimum distribution.
It's not optional.
No, and the IRS used to be extremely lenient extremely lenient with people that did not take it out. They have become less so in the last decade because the government perceives that the minimum distribution rules have been simplified. I don't believe they have, or they're a little simpler, but I don't think they're as simple as people not making errors. So.
Well, and the interesting thing, though, is that you have people that sometimes come in with that defiant attitude saying, well, I'm just not going to take it. I'm not going to pay taxes. And at the end of the day, you may end up giving the government almost all of it by that attitude.
Yeah, like I said, when the government catches you, you will not only have to pay tax, but you will have to pay severe penalties. And then once they calculate your tax and penalties, it's 2 years after the fact. Then they tack on interest. Then they send a note to the state government saying, hey, this is what we hit the guy for, and then you get a notice from the state government tacking on tax, penalty, and interest. It is just ugly.
So the challenge, once again, is you get those, pay attention to it, schedule an appointment with your CPA to make sure there isn't something else you can do, but you are going to be taking them.
Or more importantly, don't even wait for the notice. Know once you hit 70.5, the previous December 31st total of all your IRAs divided by your life expectancy, and there is a chart that the IRS updates annually. And if you're married, it's a joint chart. You just find your age, look at the life expectancy. It's a great thing. The IRS knows.
Pete, as always, thanks for taking time to appear on the program.
Great to be here.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just as simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.